Hi, let's delve into the critical role of recognizing distress signals for effective psychological first aid, which is essential for timely intervention and support. Effective response in providing psychological first aid begins with the accurate recognition of distress signals. Understanding these signs allows first responders and caregivers to intervene appropriately and provide immediate support, potentially mitigating more severe mental health crises. In this module, we'll be looking at how to identify psychological distress by looking at key indicators of the distress, the common ways they present through their signs, and how to apply them as a first responder. First responder play a crucial role in identifying mental health crises. They must be highly observant, recognizing any dramatic changes in an individual's mood, behavior, or daily routines that deviate from their norm. This may include dramatic shifts in mood, behavior, or daily activities. One, by being the first on the scene, you need to quickly notice if someone is having more than just physical injuries. Mental health crises can be less visible but equally urgent. Watch for signs that might not be obvious. For example, if someone is usually calm but now seems agitated, withdrawn, or excessively worried, this could be clues that they are struggling with their mental health. Always keep an eye on how people are behaving. Changes in what they do, how they speak, or how they interact with others can tell you a lot. Sometimes it's not just what you see, but what you hear. People might express fear, confusion, or despair. Listening carefully can help you understand their needs better. When you notice these changes, approach the person gently without making them feel watched or judged. Offer support and let them know you are there to help. Subsequent modules will provide more ways to help you address these visible and invisible needs. Let's discuss key indicators of psychological distress to be aware of. The first is personal neglect, and it refers to when someone starts to ignore basic personal care. This can be noticeable in two ways: uncharacteristic disregard for personal hygiene, or sudden lack of interest in appearance. How to spot personal neglect in psychological first aid is to look for visible changes. Notice if someone's clothes are dirty or if they have a noticeable odor suggesting they haven't been taking care of themselves, and observe for some of these behavioral changes. For instance, somebody is avoiding public or social interaction. This could be because they are aware of their state but feel unable to address it. Recognizing this sign is crucial because they offer a non-verbal cue about someone's mental state. In psychological first aid situations, especially after disasters or traumatic events, people might neglect personal care not out of laziness but because they are overwhelmed or depressed. Observe key behavioral changes such as social interaction shifts. This refers to noticeable changes in how someone engages with others. Here's what you might see: withdrawn from social engagement, usually present as someone who is usually social and outgoing, and suddenly starts avoiding friends, family, or social events. It could be a sign that they are experiencing emotional distress. It's important to note the changes from their normal behavior. A person who is naturally introverted may not engage much anyway, but if they withdraw even more than usual, it could be concerning. The second major way to look at behavioral change is mood fluctuations. And changes in mood can be sudden and noticeable through the following key signs: increased agitation without apparent clues. And this could present as if someone becomes easily upset or irritated, and there's no clear reason. It could indicate underlying stress or emotional problems. Uncharacteristic aggressive behavior to watch out for that aren't typical for the person, such as shouting, snapping at others, or being physically aggressive. And this could be spotted by paying attention to how the person's interests with others and how they deviate from their normal demeanor. And this can also be taken further to listen to concern from others, as sometimes friends or family will notice changes first. They might express concerns about the person's behavior or mood. These signs are often early indicators of psychological distress that could worsen if not addressed. In the context of psychological first aid, recognizing these signs early can lead to timely support that might prevent further psychological distress or deterioration. The third sign indicator to look out for are under cognitive signs, and this involves changes in how a person thinks, remember, or concentrate. Here are some common cognitive signs to be aware of. Confusion and its impact on daily tasks can make it difficult for someone to understand what's happening around them or to complete simple tasks they would normally do without thinking. For example, they might struggle to follow directions, remember where they put things, or make decisions about everyday activities like cooking or paying bills. Two, when someone is disoriented, they might not recognize places that should be familiar, like their neighborhood or even their own home. This can be disconcerting and might cause them to get lost or feel unsafe, even in places where they normally feel comfortable. Three, after a traumatic event, it's common for people to find it hard to focus. They might have trouble paying attention during conversation, reading, or watching TV. This can interfere with their work, school, and managing personal affairs. Recognizing this sign in someone who have experienced a crisis or trauma is key to providing effective support. Cognitive impairment can make other aspects of recovery harder and can also be signs of more serious mental health conditions that might need professional attention. The fourth signs or the fourth indicator to look at are emotional expressions, which can manifest as intense fear, ongoing sadness, or unchecked anger, often appearing excessive for the given situation. Displays of overwhelming fear, displays of overwhelming fear in someone who is extremely anxious, jumpy, or scared might make them to be startled easily or seem paranoid about their safety even in a safe environment. Persistent sadness might look like frequent crying, a withdrawn demeanor, or a lack of interest in activities they usually enjoy. The person may speak about feelings of hopelessness or express a negative outlook on life. Uncontrolled anger could manifest as irritability, short temper, shouting, or even aggressive behavior towards objects or others. Understanding these emotional signs is important because they can indicate a person is struggling to cope with their experiences and might need additional support. Recognizing and addressing these emotional manifestation appropriately can prevent further psychological harm and assist in the individual's recovery process. The fifth indicator are verbal cues, and they are important because they indicate mental health distress in the following way. Expression of hopelessness in people must sound like, what's the point? Or nothing is going to get better. This statement can indicate that a person feels there's no positive outcomes in sight. Feeling of helplessness in a statement often sound like, I can't do anything right, or I'll be useless in this situation, can show that a person feels they lack control over their life or situation. Among the signs of potential harms are thought of self-harm in people and often express thoughts of hurting themselves or talking about their life as if there is no future, using phrases like, I did better be off dead. Expression of harming others might be picked in someone's making statements about causing harm to others or speaking with unusual aggression towards specific people or group. For emphasis, be attentive to these people. Be attentive to what people say is just as important as noticing what they do. Verbal cues can provide critical insight into a person's mental state and intentions, helping to prevent harm by addressing these signs early with appropriate intervention. Trainings should focus on listening skills, empathy, and knowing when and how to connect someone to further support. The sixth signs are physical signs, and here's how to understand some of the physical signs that indicate health challenges. Fatigue or restlessness in people might look like being extremely tired, yawning frequently, or having trouble staying awake. Alternatively, they could appear unable to sit still, constantly moving, or fidgety. These signs can indicate that a person is overwhelmed, possibly dealing with distress or stress, anxiety, and not getting enough rest due to emotional distress. Unexplained body pain is the second way that people do express physically emotional problems, and this can occur in form of headaches, backaches, or other aches that don't have a clear physical cause. Physical pain can often be a manifestation of psychological distress. When people are stressed or anxious, their body can respond to physical symptoms. Weight fluctuation is often noted as weight loss or gain over a short period without significant changes in diet or exercise habits. Significant changes in weight can be a sign of emotional distress. Depression, anxiety, and stress can lead to changes in appetite and activity level that affect weight. Recognizing these signs is crucial as it enables first responders to provide appropriate support and intervention to those in need, potentially preventing the worsening of this condition. Always approach such topics sensitively and encourage professional help when necessary. The seventh signs is to look for emotional signs, and these include excessive and unfounded feelings of guilt or worthlessness, a noticeable loss of interest in activities that were once enjoyed, and an ongoing sense of sadness or absence of emotional expression. Excessive guilt or worthlessness is someone might manifest as constantly blaming oneself for things that aren't one's fault or that are out of one's control. It might also include talk about feeling unworthy or useless. These feelings can be symptoms of depression and anxiety and might interfere significantly with a person's daily functioning. Loss of interest is a noticeable lack of enthusiasm towards activities that one used to enjoy, whether it's hobbies, socializing, or other interests. This could be a sign of depression or burnout. Losing interest in daily activities is a common symptom where people are emotionally distressed. Persistent sadness is ongoing sadness that doesn't seem to improve or a generally flat emotionless state. This persistent emotionless state is often associated with depression and can make the person feel stuck or hopeless. By recognizing these signs, you can offer immediate support and facilitate connection to more specialized help, fostering recovery and resilience. This slide highlights key behavioral signs that may indicate distress, such as substance use, altered sleep pattern, and avoidance of social activities. These are the ways that behavioral signs of mental distress often manifest. Substance abuse is when someone starts using drugs or alcohol more frequently as a way to cope with stress or emotional pain. Substance abuse can be a sign that someone is trying to manage overwhelming feelings or escape from problems. It often indicates deeper psychological distress. Sleep pattern changes is the significant changes in how someone sleeps, which could be difficulty falling or staying asleep, which is termed insomnia, or sleeping too much, which is termed hypersomnia. Changes in sleep pattern are common indicators of mental health issues such as depression, anxiety, or stress. Social and work avoidance and noticeable reduction in participants social and work and noticeable reduction in participation in social activities and responsibility at work or at home. Avoiding social and work engagement can be a sign of underlying mental health problems like depression or anxiety. It may also indicate burnout or stress overload. Your role is to provide immediate support and connect them with further resources that can help them manage their issues more effectively. Psychological signs that may indicate distress include increased sensitivities to rejection, difficulties in decision making, and frequent feelings of anxiety or panic. Rejection sensitivity in people make them to react very strongly to criticism or perceived slight. They may become very upset or withdrawn after what seems like a major rejection or failure. This heightened sensitivity often stems from underlying feelings of insecurity or past experiences of significant reduction. Decision-making challenges in traumatized individuals might appear usually indecisive, stressed when faced with choices, or may avoid making decisions altogether. Difficulty in making decisions can be linked to fear of making wrong choices, lack of self-confidence, or could be a symptom of a mental health disorder like depression or anxiety. Signs of anxiety and panic can include rapid breathing, trembling, sweating, an overwhelming sense of dread, and an inability to calm down. Regular or intense anxiety and panic attacks can be symptoms of another anxiety disorder, which might require professional treatment. Your role is to provide initial support and ensure the individual feels heard and supported. When learning to provide psychological first aid, it's essential to understand these three key aspects: identification of distress signs of distress is the critical first step in PFA. It involves observing changes in behavior and emotional states that suggest someone is struggling. Identifying these signs early help you determine how best to approach and support the person. It sets the foundation for all the help that follows. Once distress is identified, PFA involves applying specific intervention tailored to the needs of the individual. This might include techniques to calm someone down, such as deep breathing exercise or grounding, or providing emotional support through active listening and reassuring presence. These interventions aim to stabilize the person's emotional state, prevent the situation from worsening, and help them begin to cope with the immediate crisis. Part of psychological first aid is recognizing when someone needs more than can be provided on the spot. This involves facilitating access to professional mental health service. While PFA provides immediate support, professional help may be needed for long-term recovery. Ensuring that individuals have access to this service provides them with the resources they need to heal fully. By mastering these steps, you can provide effective first aid that addresses immediate needs and support long-term recovery. This is just about responding in the moment, but also about connecting people to the resources they need to heal recovery. In summary, this module on identifying distress underscores the crucial role that recognizing distress signs plays in effective psychological first aid delivery. It equips first responders with essential skills to enable early intervention in psychological health crisis, which is vital for preventing the worsening of condition. Understanding and identifying early warning signs empower providers and responders to act effectively, thereby preventing psychological deterioration. Additionally, the foundational knowledge gained through this training facilitates swift and compassionate support, which is pivotal for the individual recovery process. By mastering these skills, participants are better prepared to offer meaningful support in times of need, enhancing their ability to contribute positively to someone's path towards recovery. Thank you.